Diabetic emergencies and altered mental status. So, this is talking mostly about diabetes and other reasons for altered mental status. We're talking about normal consciousness and how it is regulated. And there's something called the reticular activating system that regulates our awareness and what level of awareness we're at, whether we're sleeping or whether we're wide awake. So, normal consciousness is regulated by a series of neurological circuits in the brain that comprise the reticular activating system. The RAS is responsible for functions of staying awake, paying attention, and sleeping. So, our RAS, reticular activating system, keeps the person alert and oriented. Requirements for the brain tissue of the reticular activating system to function is that first, it needs oxygen to perfuse the brain tissue. Then it also needs glucose to nourish the brain tissue. And then it needs water to keep the brain tissue hydrated. Well, look at that. That's the same thing that every cell in our body needs. But the brain needs it much more than any other tissue in our body other than the heart. Some causes of altered mental status could be then a deficiency in any one of those, oxygen, glucose, or water to the brain tissue. Some other things that can affect it is trauma, infection, chemical toxins that harm the brain tissue, or a primary brain problem, such as a stroke, or a problem within another system, which causes hypoxia, such as in asthma. If there's hypoxia to any other tissue, it's probably going to have a hypoxia to the brain also. A patient with altered mental status can be dangerous to responders. They can be confused. They can be combative. So always think of your safety first and your team, then the patient before you approach. Use law enforcement if necessary. Assess the patient with mental status actually before you even get to their side. If they turn and look at you, then they are automatically alert. Or talk to them, then they respond to your verbal. And then if they don't respond to that, then you would do something like a sternal rub to assess their level of pain or whether they're totally unconscious. So sometimes they may have had what's called a syncopal event. Syncope is fainting. It's a brief loss of consciousness, and they'll regain consciousness once they end up lying flat on the floor. Hypoxia is one of the most common causes of altered mental status. Always consider the possibility of airway and a breathing problem in somebody with an altered mental status. Identify and treat life-threatening problems, and then give oxygen, and then be alert to the need for positioning and suctioning if the patient requires it or if mental status worsens. And then you want to determine a baseline mental status for your patient using AVPU. In your secondary assessment, thoroughly examine the patient exhibiting any new or unusual behavior. Even slightly altered mental status indicates a serious underlying issue. So, perform a primary assessment and determine if the patient's mental status is altered. In your secondary system assessment, body systems exam and complete history may reveal information about the suspected cause of altered mental status. You can interview family members and bystanders to obtain the patient's baseline mental status, or the family may be able to provide information that the patient cannot give you themselves. Patients' medicines can point to some relevant medical history and what's going on. So look for any medicines around that might clue you into what they might take that would affect their mental status. Look for medic alert bracelets or other health related items at the scene to give you clues. For pediatric patients, children may not be able to answer questions in the same manner as adults, and therefore mental status is often difficult to establish. So you have to ask parents or caregivers, are they acting any differently than normal? So think about it. What kind of information about a patient's altered mental status might you obtain from the scene? How might bystanders help you identify the cause of altered mental status? They can give you important clues about events that might have happened prior to the patient passing out or becoming altered. Diabetes. So, glucose is very important to our bodies, and glucose comes in the form of sugar. It is our body's basic source of energy, and every body cell requires glucose to remain alive and to create energy. It's the glucose and the oxygen that combine in the cell that create ATP and make energy. So if you don't have glucose, then you're missing a very important component in the manufacturing of energy. The glucose molecule is large, and it's so large that it'll just float around in the bloodstream and cannot pass into the cell without a security guard, so to speak, or insulin to open up the pathway into the cell. Our body makes insulin in the pancreas. The pancreas releases insulin into the bloodstream. Blood sugar from the digestive system is put into the bloodstream when we eat, and so blood sugar is floating around in the bloodstream. Insulin comes along, pairs up with it, and takes it into the cell. It helps to get the large glucose molecule into the cell. So insulin is produced by the pancreas. It binds to the receptor sites on cells, and it unlocks the door, so to speak, which allows large glucose molecules to pass into the cells. So everybody per se needs to have adequate sugar intake and adequate insulin production to balance how the body uses the glucose effectively as an energy source. The problems happen when the pancreas does not make enough insulin, or when we eat too much sugar and that the pancreas can't keep up. And then we have a condition called diabetes mellitus. There are two types. Type 1 is generally the lifelong diabetic, the person that gets it from their youth. This is where the pancreas cells do not function properly, and therefore insulin is not secreted normally. Not enough insulin is produced to transfer the circulating glucose into the cells. These people that are type 1 generally have to take a synthetic insulin prescribed to supplement the inadequate natural insulin that their pancreas does not produce. So type 1 diabetics have the disease most of their lives, and it's because their pancreas is not functioning properly. Type 2 diabetics. This is the person that might develop diabetes later in life. The body cells fail to utilize the insulin properly. So the pancreas is secreting enough insulin, but the body isn't able to use it to move the glucose into cells. It's kind of, they've become a little bit, the body's become insulin resistant, is what they may term it as. The condition is often controlled through diet and through oral anti-diabetic medications. It's only until later in life that they may actually develop to take an insulin. So these people get it later in life, type 2, and on occasion it may worsen to where they have to take supplemental insulin, but generally they try to control it through diet and through some medications that they may take. Something called metformin is a common one that tries to stimulate insulin production in their pancreas, um, and help keep the body cells utilizing the insulin like it should. So when you are responding to somebody that has diabetes, you might have one of a couple of types of emergencies. One emergency, and the most common emergency, is called hypoglycemia. It's a low blood sugar. It can happen because the diabetic takes too much insulin, and then that takes all the glucose out of their blood and puts it into the cells, and now they don't have any glucose in their blood supply for future use. And you got to have a constant supply. And so they may have taken too much and now there's not enough sugar in their bloodstream. The diabetic might not eat, and then they don't have a source for glucose and nothing in their bloodstream then. Diabetic overexercises or overexerts and uses more sugar, and then they're low on sugar. Or they may have eaten and vomited and therefore didn't get the amount of required glucose into their bodies. They could have another thing happen, an increase in their metabolic rate. When we have a fever or we shiver, we use a little bit more energy than normal and our metabolism increases. And this would also require an increased consumption of glucose. And if you don't adequately put enough glucose into your body, then you're not going to have enough glucose in your blood. And that would be hypoglycemia. Some signs of hypoglycemia. It's got a very rapid onset, can happen within hours. It may present with abnormal behavior. Maybe they look like they're drunk, or they're acting crazy or combative. Pale, sweaty skin, fast heart rate or tachycardia, rapid breathing, and it even can progress at times into seizures. The results are starvation of brain cells, not enough glucose, and the brain is very sensitive to not enough glucose. So they might have an altered mental status, unconsciousness, permanent brain damage, or even death. The next diabetic emergency that you might have would be something called hyperglycemia, high blood sugar. So some causes of that would be a decrease in insulin. It might be due to the body's inability to produce insulin, or it might exist because somebody taking insulin injections has not taken a sufficient quantity of insulin. And then you have blood sugar that's just floating around in the bloodstream, unable to get into the cells. So the source of energy is there, but it's not able to be put into the cells because insulin is inadequate. Some causes of hyperglycemia might be stress or increasing dietary intake, eating too much. Some signs might develop over days or weeks. This comes on fairly slowly, and you might notice it because there's chronic thirst and hunger. There might be an increased urination. There's nausea, maybe. The results would be a profound dehydration because the fluid shifts from out of the cells, actually. And so the person in hyperglycemia will actually be a little dehydrated. Excessive waste products released into the system. So a hallmark, a particular condition of hyperglycemia is called diabetic ketoacidosis, DKA. So one of the waste products that's released of the body trying to survive without the glucose is something called ketones. So ketones are released into the bloodstream, which makes the body a little bit acidotic. So that's why it's called diabetic ketoacidosis, which is a hyperglycemia, high blood sugar. Diabetic ketoacidosis is a profoundly altered mental status. There's shock, which is caused by the dehydration of the cells, rapid breathing, and they may have an acetone odor or a fruity smell on their breath. What do you want to do? Make sure that the scene is safe. Do your primary assessment. Identify an altered mental status. Remember, the purpose of a primary assessment is to determine threats to life and to fix them. A threat to life is an altered mental status. So you're going to work to try to fix that by determining the cause of the altered mental status. Do your secondary assessment once you've taken care of that. So you might need to get a history of what's going on, what the present episode is going on, how it occurred, time of onset, what were they doing when it started, how long did it last, what signs and symptoms do you see, was there any mechanism of injury or other evidence of trauma, anything interrupting it, seizures, fever. Do your sample history, signs and symptoms, allergies, medications, pertinent past history, last oral intake, and events. This is very important in the diabetic patient. You may have to question the patient or bystanders. Look for a medical ID bracelet. Look in the refrigerator or elsewhere to look for medications. You might see insulin or you might see other diabetic medications, something like metformin or Lantus. Perform blood glucose monitoring if local protocols permit you to do so. In Nauvoo, you will be able to do glucose monitoring. The glucose monitor measures the amount of glucose in the bloodstream. A lot of times people use them at home if they have diabetes. In our protocol, we use them, our EMTs use them. And so what you do is you take a little meter and it's got a strip with it, and you actually poke the patient's finger with a needle and you put some blood on it, and it measures the amount of glucose in the bloodstream. So, can you guess what the appropriate amount of blood glucose is? Anywhere from 60 to 100, or even just a little higher than that would still be normal. Blood glucose measurement. Less than 60 in a symptomatic diabetic patient is hypoglycemia. Less than 50 with significant alterations in mental status should definitely be treated. If it's greater than 140, then it's considered hyperglycemia. If it's greater than 300 for a prolonged amount of time, you're going to see signs of dehydration or other serious symptoms. Special glucometer readings might display a word instead of a number. It might say high. This indicates an extremely high level, usually greater than 500. So if you don't get a number reading and it says high, it's probably higher than 500. If it's low, generally the monitors won't pick up anything less than 15. So if you see something that says low, then it's pretty low. And here's a picture of a glucometer. You can see it's got the glucometer, it's got the test strips, it's got an alcohol prep to wipe the site with, and then that is a little lancet, they call it, that pokes a hole into the skin to get blood out. Occasionally one can treat person with mild hypoglycemia and minor altered mental status by simply giving something to eat. Never administer food or liquids to patients at risk for aspiration. A lot of times, the family members of the diabetic patient might give milk or orange juice to bring a blood sugar up. What we keep on the ambulance is called oral glucose, and it's basically a tube full of a sugary type gel. Your criteria for administering oral glucose is that they have to have a history of diabetes, an altered mental status, and they have to be awake enough to swallow it. What do you do to give it? Well, generally you just squeeze the glucose from the tube directly into their mouth. And on occasion you can give it by using a tongue depressor. It's been my experience that that hasn't worked very well. And here's a patient taking some oral glucose. Oral glucose is given, then you need to reassess the patient after you give it. And if the condition does not improve, consult medical direction about whether or not to give more. Generally, you can give more with no problems. So, what's the difference between hypoglycemia and hyperglycemia? Well, the onset is one thing. For a hyperglycemia, it comes on more slowly, while hypoglycemia tends to come on more fast. The skin. Hyperglycemic patients often have warm, red, dry skin, while hypoglycemic patients have cold, clammy skin. Remember, hyperglycemia is the dehydrated patient. Their breath smell. The high blood sugar patient typically has an acetone breath or a fruity breath. Not all patients exhibit this sign, but some will.
Diabetes mellitus is a complex disorder of metabolism. It is a disease in which the body does not produce or properly use insulin. Insulin is a hormone that is needed to convert sugar, starches, and other food into energy needed for daily life. There are three major types of diabetes. Type 1 diabetes, also known as insulin-dependent diabetes mellitus, IDDM, or juvenile onset diabetes, results from the body's failure to produce insulin. An individual with type 1 diabetes needs to take daily insulin injections for the rest of their lives. It is estimated that 850,000 to 1.5 million Americans have type 1 diabetes. Non-insulin dependent diabetes mellitus, or adult onset diabetes, results from insulin resistance combined with relative insulin deficiency. Approximately 16 million Americans have type 2 diabetes. Someone with type 2 diabetes may make healthy or even high levels of insulin, but obesity makes the body resistant to its effect. Even modest lifestyle changes, such as eating a healthy diet, exercising 30 minutes a day, and maintaining proper body weight for age and body type, can help prevent type 2 diabetes. Prediabetes occurs when a person's blood glucose levels are higher than normal, but not high enough for a diagnosis of type 2 diabetes. Without lifestyle changes, most people who have prediabetes will progress to type 2 diabetes within 10 years. Gestational diabetes, or pregnancy-induced diabetes, develops in a pregnant woman. In most cases, this type of diabetes goes away after the child is born. It affects about 4% of all pregnant women, or about 135,000 cases in the United States each year. The American Diabetes Association estimates that about 17 million people in the United States have diabetes, and 5.9 million Americans have diabetes and do not know it.
There are other causes of altered mental status besides diabetes. For instance, sepsis. Sepsis is a collection of problems that are associated with a response to an infection. And it occurs when steps normally taken to fight infection move from the local site and they become more generalized or systemic throughout the whole body. If severe enough, the microbes of the offending infection can release toxins that actually harm cardiac output. The following findings might indicate that a person has a severe sepsis: altered mental status, an increased heart rate, an increased respiratory rate, a low blood pressure, a high blood glucose, or a decreased capillary refill time. Seizure disorder can be another cause of altered mental status. If normal brain function is upset by injury, infection, or disease, the brain's electrical activity can become irregular, and this results in a seizure. It's a sudden change in sensation, behavior, or movement. Seizure is a sign of an underlying defect, injury, or disease, and not necessarily a disease in itself. There are two types of seizures. There's a partial seizure, which affects only one part or one side of the brain, and the patient may not lose consciousness with a partial seizure. There's also a generalized seizure, which affects the entire brain and affects the consciousness of the patient, so they become unconscious if it's generalized. There's a tonic-clonic seizure, and these are kind of states. Unconsciousness and major motor activity happens with tonic and clonic. Tonic phase is when the body is rigid for up to 30 seconds. And the clonic phase is when the body actually jerks violently for 1 to 2 minutes. And then once that happens in the tonic-clonic seizure, they'll be in a postictal phase. This is after the convulsions stop, and it's kind of a period where the person slowly regains consciousness. They don't remember what happens, and they might be a little bit confused during the postictal phase. Some seizures are actually preceded by an aura, which is a sensation the patient has just before it's about to happen. They might have a smell or a sound or just a general feeling that kind of lets them know that they're going to be seizures. Interestingly enough, there are some dogs that can detect the aura or know when their master is about to have a seizure. Causes of seizures can range from hypoxia to stroke to a traumatic brain injury or a toxic substance, or even hypoglycemia can cause seizures. Brain tumors, congenital brain defects, infection, or there can be metabolic causes, changes in the metabolism of our body. And then there are some causes of seizures that they don't really know or understand. They call them idiopathic. Epilepsy is another common seizure disorder, cause of a seizure. Measles, mumps, and other childhood diseases can cause seizures. Eclampsia is a seizure when the woman is pregnant. And there's also heat strokes that can cause seizures. So you can also be sure and read about seizures in your book on page 544, 545, and 546. But it's important to know when you do your patient assessment is what was the person doing before seizures started? And exactly what were they doing during the seizure? What did it look like? A lot of times you arrive to the patient when they're in the postictal state. So it's uncertain as to what type of seizure activity they actually had. So questions along this line will help you to relay the information to the hospital and the doctor. You want to know how long did the seizure last? And then what did the person do after the seizure? So if you are present though, when a convulsive seizure occurs, what you want to do is place the patient on the floor or ground, loosen any restrictive clothing, remove any objects that might harm the patient, and protect the patient from injury. But don't try to hold them still during the convulsions. Let them convulse, just don't let them hit anything or get hurt. After the convulsions have ended, protect the airway. If there's not a chance that they have any spinal injury, you can place the patient on one side. If the patient is cyanotic, however, you need to protect their airway, open it, and start giving artificial ventilations with a bag valve mask and supplemental oxygen. After they've ended, give them make sure they're breathing adequately. Put them on an oxygen mask or nasal cannula. Treat injuries that they may have sustained during the convulsions, and then transport them. There's a condition called status epilepticus. That's when two or more convulsive seizures in a row occurs without regaining full consciousness, or it can be a single seizure that lasts more than 10 minutes. This is a life-threatening emergency. That person really is not getting the adequate amount of oxygen they need, and the seizure needs to be stopped. So it's a high priority emergency which requires immediate transport to the hospital and even ALS intercept to try to protect. Not all seizures present as generalized tonic-clonic seizures. Partial seizures might be uncontrolled spasm or convulsion while the patient is still fully alert. There can also be a complex partial seizure, which is often preceded by an aura. Generalized seizures, the tonic-clonic seizure, is one of them. There's also the absence or petit mal seizure. This is a brief period without dramatic motor activity. They could have a temporary loss of concentration or awareness. It might actually go unnoticed by everyone except the patient and knowledgeable members of their family. These are the people that you hear about that are kind of staring off in space, that maybe sometimes in school they notice as they think the person is daydreaming or something, and it comes back that they're actually having little absent seizures. Another cause of altered mental status is a stroke. This is death or injury of the brain tissue from being deprived of oxygen. There's causes of that, including a blockage of arteries supplying the blood to part of the brain, or bleeding from a ruptured blood vessel in the brain. So, two different types of strokes. One is a blockage, and one is a hemorrhage. Some signs and symptoms of stroke would be one-sided weakness. We call this hemiparesis, and it's very common. Difficulty speaking or complete inability to speak. Headache caused by bleeding from a ruptured vessel. This is less common, but it's very important, and it will maybe help distinguish whether it's a hemorrhagic stroke or one with a blood clot. Some other signs and symptoms of stroke would be confusion, dizziness, numbness, weakness, or paralysis, usually on one side of the body, loss of bowel or bladder control, impaired vision, or high blood pressure. They might have difficulties breathing or respiration, or something called agonal breathing or snoring respirations, nausea or vomiting, seizures, unequal pupils, headache, loss of vision in one eye, and unconsciousness. which is less common than some of the other signs and symptoms. If you're communicating with a stroke patient, sometimes it's difficult because they won't be able to talk back or they have slurred speech that you won't be able to understand them. Damage to the brain can cause partial or complete ability to use words. Um, they might have what's called aphasia, which is just a term that means they can't talk, they can't communicate. A transient ischemic attack is a TIA. This is a mini stroke, as some people refer to it. They're small clots that temporarily block circulation to part of the brain, and it causes stroke-like symptoms. And the symptoms resolve when the clot manages to break up or move on. There'll be a complete resolution of symptoms from a TIA when you don't even have any treatment within 24 hours or sooner, usually sooner. Now, you want to check for strokes, and there's several types of assessments you can do to evaluate whether or not the person is having a stroke. One of them is the Cincinnati Pre-Hospital Stroke Scale. I want you to read about that further on page 551. It's on 550 and 551. A stroke patient is more likely to show an abnormal response when you do the Cincinnati Pre-Hospital Stroke Scale. So you ask them to grimace or smile. And in a stroke patient, they usually have a droop on one side of their mouth. So they'll have what's called facial droop. The face of a stroke patient often has an abnormal dropped appearance on one side. Then you ask the patient to close their eyes and extend their arms straight out in front for 10 seconds. And generally, what you're looking for here is called arm drift. So here's somebody, she's got her eyes closed, she's holding her hands out. In a patient having a stroke, both arms will one arm will kind of fall to the side if they're having a stroke. So you assess for arm drift by asking the patient to close her eyes and extend her arms, palms up for 10 seconds. A patient who has not suffered a stroke can usually hold her arms in this extended position with their eyes closed. But if they have a stroke, then one arm will drift away compared to the other one. And this is somebody whose arm is drifting away. And then you ask the patient to say something. You're assessing their speech here. So ask him to say, "You can't teach an old dog new tricks." A patient should be able to say this quite easily without slurring or using inappropriate words or not talking at all. For conscious patients who can maintain an airway, you need to calm and reassure them, monitor their airway, give them high concentration of oxygen if it's below 94% or if there's signs of hypoxia or respiratory distress, and then transport them quickly. An unconscious patient or a patient who can't maintain their own airway, you need to give them high concentration of oxygen and transport them as quickly as possible. They need to be transported to a hospital that is a stroke center with the capabilities of doing a CT scan at a minimum, and even better if they have neurosurgical staff on duty. It's really important in stroke patients to determine and document the exact time that the symptoms started, because if you know when that happened, there's a specific criteria that the hospitals need to know in order to give them the clot busting drug that they would give to resolve the stroke. So document contact information of anybody that would be able to provide information about when the symptoms started. and be very specific about that. That's part of the criteria for the treatment of stroke. Dizziness and syncope. This can indicate serious or life-threatening problems. So it may be possible to diagnose, it may not be possible to diagnose a true cause of syncope. Dizziness is a common term. It sometimes means different things to different people. So you need to really delve into your OPQRST and your sample history with dizziness and syncope. Vertigo is a sensation of your surroundings spinning around you, and lightheadedness is the sensation you are about to pass out, sometimes called pre-syncope. So there can be with syncope a brief loss of consciousness with a spontaneous recovery. Typically, this is very short. Syncope is a lot of times just simply fainting. It lasts for a few seconds to a few minutes. Patients may have some warning that they're going to faint, and they may say something or try to sit down beforehand. But there's causes that you should suspect when you are going to care for a patient that is passed out. There's cardiovascular causes, one of them being either a slow heart rate, and even a fast heart rate can cause decreased cardiac output and then syncope. There's another thing that we call a vasovagal syncope. It's thought to be the result of stimulating the vagus nerve, which goes down from through the neck, and it actually innervates into the heart and helps the heart rate speed up, or vagus nerve, if it's stimulated, will slow down the heart rate. So decreased cardiac output can cause syncope if that vagus nerve is stimulated. There's hypovolemic causes, so they could have a low volume, low fluid or blood volume causes dizziness or syncope, especially when the patient attempts to sit or stand up. A source of bleeding may not be obvious, so always suspect and do a thorough exam. There can be metabolic and structural causes. Alterations in brain chemistry or structure can lead to a diminished level of consciousness. There can be middle or inner ear problems also causing dizziness or syncope. You can have environmental and toxicological causes too. Alcohol and drugs can cause fluctuations in consciousness too. And then there's tons of other causes. In half the cases, no cause is ever found for dizziness and syncope. So what are you going to do? Well, rapidly identify and treat any life-threatening problems. Gather important information that's going to assist in overall treatment. Ask them, have you ever had anything like this happen in the past? And try to get them to be specific. What type of dizziness? How does it feel? Ask, did you have any warning? When did it start? How long did it last? What position were you in when the episode occurred? And then you take any medication for this kind of problem. Do you have any other signs or symptoms? Nausea. Did you witness any unpleasant sight or experience a strong emotion? Did you hurt yourself? Did anyone witness involuntary movements of the extremities like seizures? And then administer oxygen based on their O2 sat levels and their level of distress. Be sure and call for ALS. Loosen tight clothing around the neck. Lay the patient flat and treat associated injuries that the patient may have incurred from the fall. Is the seizure or syncope a symptom of a larger problem? It could be, and cardiovascular being the big one that you really have to watch for and do a thorough assessment.
Transient ischemic attacks are temporary and short-lived cerebral ischemic episodes that may be caused by a variety of factors. Here we see the cerebral vascular supply showing the carotid and vertebral arteries. and the circle of Willis. In stenosis of the vertebral or carotid arteries, the reduced blood flow is insufficient to maintain adequate cerebral perfusion, and transient focal ischemia occurs. Other causes include subadventitial arterial dissection, which creates a false lumen that can cause stenosis, occlusion, or pseudoaneurysm of the vessel. The dissection may also cause the formation of a thrombus from which fragments embolize. Arteritis or inflammatory vasculitis may cause segmental stenosis and distal ischemia.
So, in review, diabetic emergencies are usually caused by poor management of the patient's diabetes. Diabetic emergencies are often brought about by hypoglycemia or low blood sugar. When in doubt, assume that it's a low blood sugar. The chief sign of this hypoglycemia is an altered mental status. Whenever the patient has an altered mental status, a history of diabetes, and can swallow, administer oral glucose. Seizures may have a number of causes. Assess and treat for possible spinal injury, protect the patient's airway, and provide oxygen as needed. You should gather information about the seizure to give to the hospital personnel. A stroke is caused when an artery in the brain is blocked or ruptures. Signs and symptoms of stroke commonly include an altered mental status, numbness or paralysis on one side, and difficulty with speech. For stroke patients, ensure an open airway and provide supplemental oxygen. Determine the exact time of onset of symptoms and transport promptly. Dizziness and syncope or fainting may have a variety of causes. In the case of syncope, administer oxygen, loosen clothing around the neck, and place the patient flat with raised legs if there is no reason not to. Treat any injuries in transport. Determine if the patient's altered mental status is being caused by hypoxia. In a patient with a hypoglycemic emergency, determine whether the mental status will allow the administration of oral glucose. Assess the seizure patient to determine the need for artificial ventilation. Determine when the symptoms of the stroke began. And some questions to consider would be: know the chief signs and symptoms of a diabetic emergency. Explain how you can determine a medical history of diabetes. Explain what treatment may be given by an EMT for a diabetic emergency and the criteria for giving it. Explain the care that should be given to a conscious and an unconscious patient with suspected stroke. Explain the care that should be given to a patient who has experienced dizziness or syncope. So, let's do some critical thinking. A 62-year-old male is witnessed to have a tonic-clonic seizure. You find him actively seizing. His skin is pale and moist and slightly cyanotic. What would the immediate treatment be? Just given that the fact that somebody witnessed a tonic-clonic seizure and you get there and he's still actively seizing might lead me to believe, unless you're really quick at getting to the scene, that he might be heading towards status epilepticus. Remember, that's a life-threatening seizure condition where he's actually seizing for 2 or more times in a row or for more than 10 minutes continuous. And the fact that he's cyanotic means that it is affecting his breathing. He's hypoxic. So he needs his airway cared for immediately. Maybe try to ventilate him. He needs to get his seizure to stop. You may not be able to do that, but an ALS person could possibly be able to do that. So you need to get them rendezvous or get them to the hospital as quickly as possible so that they can be treated. For further street scenes, be sure and check out page 557 and and review the street scenes and the questions there that can give you some more indications and a little bit more clinical experience.